It's that deciduation, the breakdown of the endometrial cells that give us that hyperechoic appearance encircling the blastocyst. The implantation window is 6 to 8 days after ovulation. Implantation, once it starts embedding, can take up to 4 days. That's when I have implantation bleeding. Okay. Estrogen and progesterone are produced by the corpus luteum. Both of those, it's mostly progesterone, but some estrogen, and it maintains the endometrium. It makes the endometrium healthy for implantation. Because now my decidua functionalis is not sloughing off. So it's full of blood and spiral arteries, and it's ready for implantation. Okay? The blastocyst will implant around 6 days. Takes 4 days for it to finish. The Trophoblast is the inner layer. It has villi for anchoring. The Trophoblast is the outer layer, and it puts out enzymes to break down the endometrium for the blastocyst to burrow down, and it does produce HCG. HCG shows up in my blood, and HCG shows up in my urine. It's the blood that we need to be able to see what we need to see with ultrasound. So if I have a lady that comes in from the emergency room and her HCG is 380, I don't expect to see anything. I might be able to discern deciduation of the endometrium, but I don't see anything. When it gets to about 500, that's when I'll see a gestational sac. So what does the Trophoblast do?
Tenderizing through the endometrium.
It does what?
It barrels through the endometrium.
Yeah, but what does it do?
Meteorite.
Yeah, it releases hormones or enzymes to break down the endometrium. Okay? The Trophoblast, what does it do? It anchors it. It has the little villi on it. Where it implants, that's going to be my primitive placenta. What does the amniotic cavity do?
The fluid about protect the baby.
Yeah. So if I were to get this image, that would be called a double bleb. That means I can see the amniotic sac and I can see the gestational sac at the same time. I'm not going to see it at this level because we're still young. But if I see the amniotic sac and the chorionic sac at the same time, that's called the double bleb. Okay. Decidua ViSalus. It's where implantation takes place and the basal plate is formed. You have a maternal side and you have a fetal side. Okay? You have a fetal side, you have a maternal side. Okay? Now, if it's the fetal side, it's called what? Deciduous. If it's the fetal side, it's called chorion. Okay? So, Decidua ViSalus used to be the zona ViSalus. The Decidua capsularis, the baby has burrowed down. Here's my endometrium. Here's my cavity. Okay? So the baby has burrowed. Okay? decidua ViSalus. Okay? Decidua capsularis. Okay? That's the endometrium that's covering the blastocyst. So it would be from here to here. Decidua capsularis. It's the decidua on the other side of implantation. Everything else, decidua paritalis, also known as decidua vira.
Okay,
AKA.
what is the decidua and the functionalis now?
Huh?
We have one before. Decidua functionalis.
Okay, all of this is decidua functionalis.
Oh,
Okay? All of it is decidua functionalis because it didn't slough off. Here's my canal, right? So I'm going to have a posterior placenta because it implanted on the posterior endometrium. Okay? All of this, except for implantation area right here, is decidua capsularis. It's the endometrium that is touching the blastocyst everywhere except the implantation site. Everything else, the functionalis, is now called decidua paritalis or decidua vira, which are exactly the same. Blastocyst?
Blastocyst. Yeah, is it planted on the posterior, just in the posterior?
No, it could be anterior, it could be fundal.
Mm.
Mhm. We don't want it in the lower uterine segment.
Yeah.
Because if I have it in the lower uterine segment, I have a placenta previa. And those babies have to be born by C-section. Exactly. Because at the decidua ViSalus, that's going to be my primitive placenta. Okay? Here's just another picture of it. Okay. So here's my myometrium. My endometrium is red. Red for blood, right? Okay. Decidua ViSalus. That is the maternal side of the placenta. The endometrium covering the blastocyst everywhere except the decidua ViSalus is called the decidua capsularis. Everything else, the rest of the endometrium, is called decidua paritalis or decidua vira. This is the secondary yolk sac. We don't see the primary. That's further on. That's closer to conception. Okay? This is the amniotic sac. It covers the baby. It protects the baby. There's like 7 functions that the amniotic fluid covers. Okay. Chorion frondosum. It's on the opposite side of decidua ViSalus, but now it's the baby part of the placenta, chorion frondosum. It's not on the maternal side, it's on the fetal side. Okay? Chorion laevi. It's on the opposite side. It's the decidua capsularis inside lining. It's on the baby side. It's called chorion laevi. Okay? Chorion laevi from here all the way to here. It's the inside lining of the capsularis. Decidua capsularis is maternal. Chorion laevi is fetal. Any questions? Okay, this is in your book. Here's my gestational sac. So it has already implanted at the decidua ViSalus. What covers the gestational sac? What is the part of the endometrium that covers the gestational sac? Decidua capsularis. What's going to be the fetal part of the decidua capsularis? Chorionic laevi. Got it? Okay. Here I have decidua ViSalus, maternal placenta. I have the gestational sac. What is the decidua paritalis?
Everything else.
Everything else. Okay, a pregnant endometrium. Decidua paritalis. Another name, decidua vera. Okay, so here you have the decidua capsularis, maternal or fetal? No? Maternal. What's the fetal part? Chorionic laevi. Okay? Okay, so now the baby's gotten even bigger. I have now my placenta. My maternal placenta is called decidua ViSalus. Okay? The decidua capsularis is what? Yeah, it is maternal. It's the endometrium that is covering the blastocyst. Now, if I have endometrium covering the blastocyst, now I have a chorionic cavity. What is the fetal part of decidua capsularis? Chorionic laevi. Okay? Because you have a maternal side, you have a fetal side. Okay? What are the names for the gestational sac? Extra embryonic coleum and chorionic cavity. You were going to ask something, Uba?
Yeah, when you say fetal side and the maternal side, that means like comes with the baby? Is the baby's part with it? Or
Yeah.
this is with the
You have the
something
fetal
with the
part
baby?
of embryology, and you have the maternal part of embryology.
Okay.
Now, what are the two words? Decidua is maternal endometrium. Chorionic, fetal. Okay? Fetal.
So which week, C, the placenta start?
Which part is it?
How many weeks?
Well, it looks pretty tiny. It only has little flappers there. I don't see the rhombencephalon, so all I know is it's first trimester. Okay? The blastocyst. The inner cell mass, the epiblast, which is closest to the trophoblastic cells. That is what's gonna help develop the amnion. Okay? Those primitive cells help and secrete fluid. So what does that tell you? That we need those cells to build the amniotic fluid in that first trimester. Because one, the kidneys aren't working yet. Okay, the kidneys don't start working until the second trimester. But we still need that fluid to protect the baby. So you have the epiblast and you have the hypoblast. The hypoblast is what faces the blastocyst. That